Thank you, Pekka. As a doctor, I think, are there any other doctors in the at least one I know? Okay, I thought that I will a little bit open the insights of how the healthcare system is working currently worldwide, not only in Finland or Estonia, but worldwide. So my title is From Health 1 to Health 3.0. Health 1 is changing from paper to digital. So I was involved of creating first software for the family physicians in Estonia in '94. So it was the first stage when we started to collect data, sickness data, and using digital environment. Health 2.0 is integration between different softwares. So we created an information exchange platform in Estonia 2009, similar like Kanda in Finland. So this is integration, where different healthcare providers start to share the data. So this is Health 1 and Health 2. It's mainly done worldwide, and now we can explain a little bit how the healthcare is working. So Timo already explained part of this concept, but I will give some numbers. So there is 1,000 adults from 15 to 75 in this study who were asked that how often they have some health-related problems or concerns. And 800 of them said that during 1 month, last month, I had something about my health. 329 of those decided that this is so severe that I need to see the doctor. Remember this 329. And there's another thing. What about these 471? How did they solve the problem? Did they Google? Did they take a medication of their husband? Or what was the problem? We don't know. Was it only once? Is it regular? Every month in the 5th day after getting last month's salary, maybe? So there is so many determinants which is outside of, let's say, medical issues, like your social well-being, your environment, your happiness. Everything is influencing your health. So, but those 329 decided to become patients. They pick up a phone and book the time to the doctor, and they start to circle inside the sick care environment, and hopefully the data is collected digitally to the electronic health record system. So this is how the system works now. Let's assume that all these new things, what Pekka started this morning, artificial intelligence, different types of solutions which try to understand more deeply what is going on with you. Stress measurements, social well-being, your physical activities, everything. And you have so many applications, so many services, IoT things that can collect this data. So the process, if you start the process with digital health check, like using artificial intelligence, different solutions, and getting know what is really going on. So then there is 2 solutions in very large scale. First, yes, you really need professional help from the sick care providers. Or you can manage this condition yourself with help of artificial intelligence, with help of different other well-being services which is outside of sick care. So these are 2 options. If you have already done this triage, why you should go through this hierarchic healthcare model where you have to go to your primary care physician, then you get referral, so on and so on. Why not directly go to the laboratory or to the test or to the specialist, because you have already narrowed the focus of the service what you really need. So why not to go directly to the place where you get the most relevant help? So if you look different studies, you find that 80 to 20 is also capable explain this concept. So only 160 from 800 really need to go to this special care. And others can manage the conditions themselves with help with different other services which is outside of the sick care. So this part of healthcare or sick care collects the data to the electronic health record, and we have a different concept of personal health record where these devices and collecting the data. But this is not enough. This is something what we already doing today, and this is not enough. Our focus is too much here, collecting sick episode data to the electronic health record system. And in the future, thanks to the AI, genetics, other things, we only have a small proportion of available data and information what we can use to the decision making coming from this sick care environment. And most of the data in the future are coming through the personal health account, where the electronic health record system are only one of the feeding systems, and all other services are another type of systems which feed your personal health account. The person-centric data collection is must when we talk about personalized medicine. You can't rely on service provider environment or official environment. You have to have a person-centric approach to the data collection. So the future of the data flow is through your different services, through your personal account, your personal data account, to the artificial intelligence services, back to you, and sometimes you really need professional help, and they feed also your account. So we're missing this point in the environment totally, and we don't have infrastructure, we don't have trust networks, and this is something what we're trying to build and concept now, and this is what I'm doing in Sitra at the moment. So how it look like model in 2030? So first, it is empowered citizen, community or home-based or health everywhere with you, because you have the most powerful device in your pocket, like smartphone or sensors and others. So sorry, let's go back. So point of care devices. Already today, iPhone have several applications and functionalities which is approved from the FDA as a medical device. So you have most powerful medical device in your pocket. Personal health account is in the middle, because you are the owner of the data. You should be responsible of your data and your health. And then artificial intelligence, which is supporting this data flow and giving your, let's say, the insights, hits, and other reminders and everything about your health. And all the providers can directly build the new applications using the personal account. So not to the integration to the electronic health record system, not to the national system, but directly to your account. This means that we need an ecosystem around your personal account. And we miss that at the moment. Thank you.